Hi everyone, this is Dr. Ernesto from Attaboy Cowboy, and in today's video I want to talk a little bit about shoes. So a couple days ago I got an unfortunate phone call from one of my neighbors, and they said that my neighbor, who I helped take care of, had a fall. She broke her hip, she was yelling, they had to call the ambulance, so she's in the hospital right now, getting her hip replaced. And one thing I thought about right away were shoes, because I'm always kind of not to wear sandals. Okay, so a few things about shoes. Over the years, I've been doing a lot of sports. I started at 12, I was a wrestler, I played football, I played basketball, I did track and field, I did cross country, I did marathoning, a lot of sports. And now I do a bunch of different martial arts, swimming, etc. And when I was running, and when I was playing basketball, I would frequently tear my calf muscle. And I thought, why does my calf muscle keep tearing? Because I'm strong, I'm healthy, it just doesn't make any sense. So I would spend more and more money on better shoes, and I thought that was the issue. So I started studying it more and more, and I started understanding the anatomy, because that's what I was studying in school, why I was tearing my calves. One of the reasons is that the heel lift. Now, when you look at a pair of tennis shoes, when you look at the heel is often taller than the rest of the shoe. Okay, and that's called the heel lift. And in some ways it's kind of cool because you look taller, and when they look at it in terms of athletic performance, yeah, it does give you a bit of a burst. Okay, but when you look at it functionally, it's not real good. That's why when you look at pro athletes like Kobe Bryant, or this year the Pacers, their best player got hurt, a lot of NBA players, a lot of sports, they tear their muscles, they tore their Achilles tendons, and you're wondering, why is it that they tear so much? I used to think it was because of overtraining. But oftentimes it's because of the shoes, because of the heel lift. If you look at basketball shoes, a lot of them have a really high lift in the back, and it's a trade-off. You do get a bit better performance, but it does put you at higher risk for injuries. The reason being is, over the years when I treat runners, they come in, their calves are really tight. I stretch them out, I show them stretching exercises, but as soon as they go on and run, it goes back to the same. And I'm like, why is that happening? Because when they're on that shoe lift, the foot is supposed to be flat. It's not supposed to be like this. So because it's arched up at the back, the tendon, the Achilles tendon, starts to shorten. So because it's shortened, it's more susceptible to tearing. So that's the first thing. So when you buy your shoes, try to get shoes that are as flat as possible. Now, sometimes patients will say, well, doc, I have flat arches, or I have fallen arches, or I want arch support. Arch support is different. You still want to get arch support so you can help your arch, but you don't necessarily have to have a high heel. You want the heel to be the same height as the toes, okay? Otherwise, you're gonna damage your Achilles tendon, or you're gonna put yourself in a disadvantage. That's the first point. Now, the second point is the toe spring. If you look at the front of the tennis shoe, you'll actually see it curving up with thread. And I used to wonder, why is there thread on the front of the shoe? And it's kind of lifting your toes off. And you're thinking, okay, well, why is that? So I looked into it, and yes, it does give you a bit of athletic performance, like a lift. So if you think about it, it's like you're halfway lifting your toes when you're gonna sprint down the court doing the sport. So it makes sense in terms of performance, but anatomically, it makes your foot weaker. The reason being is that when your feet are flat, you put 90% of your weight on your toes. So that makes your toes stronger, and that's like the foundation for your leg strength. It's gonna make your legs stronger, your hips stronger, your knees, your back, all of it's gonna be strong. Now, if you have that heel spring, which is often common in tennis shoes, because your feet are halfway lifted up, when you step on the ball of the foot, the toes get weaker. Inevitably, the toe, which is your most important of your toes in terms of foot strength, okay? So that's gonna make your foot weaker, your legs weaker, and you're gonna be more susceptible to having fallen arches or even plantar fasciitis. If you've ever had plantar fasciitis, it's a tendon that runs from your heel, kind of like a glove underneath your foot, and attaches to each of your toes. And that'll get really inflamed, and it's really painful to walk on. I see people with that, and they suffer quite a bit. Orthotics work, some flat shoes where the feet are not curved up with that toe spring, or you can use your toes. You can help avoid that, okay? If you have that problem, you need to work on building up your toe strength. How can you do that? You can stand on a curb or stand on the edge of a step and do toe raises. Another way that my doctor, Master Lu, showed me, Chinese medical doctor, he taught me to get a golf ball and put it between my big toe and my fourth toe. It's like stretch out that space. That actually makes the big toe stronger. As I widen that space, then I'm using my big toe and that fourth toe, kind of like pincers, to grab marbles nickels or coins sometimes and place them in something like in a basket. So that's something that he taught me. Very effective if you want to strengthen your feet and lift up your fallen arch. Okay. Now the third point you want to look at. First is the height of the heel. Second is a toe spring. The third one is the toe box where your toes go. You want to make sure it's nice and wide so your toes have room. Okay. And one thing that made me think about that was I go to the Amazon every few months. I hang out with the indigenous people. They're naked. They wear loincloths. They walk around barefoot. I look at their feet, 80-year-old women, and I'm like, wow, these feet are like, you could grab someone by the neck and choke them with it. They look so powerful. Okay. And one thing I found interesting was if you look at your toes, think about when you wear a pair of boots or high heels. What does it do to your toes? It squishes them together like this. And it squishes your toes together, all right? And that actually makes your base of support smaller. So you have less balance. You make your feet smaller and you're causing yourself foot problems like bunions or hammer toe. So you cause yourself a lot of foot problems with having snug shoes, all right? And it reminded me of a few weeks ago. I went to go buy my dad's shoes and the salesman was helping us and my dad put a pair of size 10s on, which is what he typically wears. He started pushing around the toe box. He said, okay, these feel good. They feel snug, you're okay. And I thought, that's interesting. I've been hearing that since I was a kid. Let me check it out. I checked and no, it was tight, okay? So I tried 10 and a half, 11 and a half, 12. We ended up getting my dad a 12 and a half. So he had enough room in his toe box, okay? Now, you might think, well, isn't that unsafe to have shoes that loose? No, you want to make sure the ankle is tight, and it did. He was able to lace them up perfect. The only thing is that he had a lot of room in the front, and he was able to, instead of walking with his toes like this, he was able to walk with his toes like this. That's how your toes are supposed to look like naturally. That's how the native people I see in the Amazon, that's how their toes look. When you look at their toes, when I look at their toes, they're like this. You can see daylight between the toes. When I look at other people's toes, my patients, they look like this, no deadlight. So that's not normal. That's because the shoes we're wearing are pushing our toes together. More so if you wear like cowboy boots or you wear high heels. High heels and cowboy boots are probably the worst shoes you could wear. Like, I like cowboy boots, but make sure you buy the ones that have a wide toe box so you can spread your toes up and so you don't damage your toes. High heels, there's no way around it. They're not good for you. Everybody that I see that's worn high heels for long periods of time has foot and ankle problem. Now, if you think about it, which part of your body has the most joints? Well, feet have the most joints. They're made like that. They're made so that they're kind of like a 4x4. All terrain, they adjust when you're walking barefooted. So when you wear a shoe, you lose a lot of that. A lot of that ability that we have, that innate ability. It's almost like wearing a pair of gloves on your hands to use your cell phone. That would be really hard, okay? So you don't want to do that with your feet. So as much as you can, try to walk around without socks and barefoot. That's what I do. I don't wear socks. Even when I dress up nice, I don't wear socks. I wear shoes, but I don't wear socks. Now, when I have to go to work or I have to go other places, I wear shoes that have a very wide toe box, or I wear something like sandals, like Birkenstocks, or I'll wear something like this. You see these sandals? These are the same height for the toes and the heel, okay? And that means that my toes and my heel are at the same length, so I'm not causing that problem for my gastrocnemius, my ankle. I'm not gonna cause problems for my calf muscle or my Achilles tendon. My toes are gonna be flat, so then I don't have that issue with losing strength in my big toe. And I have a strap on the back so I don't lose my balance, and I have a wide toe box in the front so I'm not compressing my toes together. So that's what I like to wear when I have to wear shoes and I'm not at work. Now at work I have to wear more professional attire, so I wear shoes with a wide toe box. Now the weight of your shoes, make sure you're buying shoes that are not too heavy, because every time you're swinging your leg when you're walking, you're what they call at mid stance. If you carry heavy shoes, it's gonna throw your balance off. You're gonna get tired, especially if you're older. You want to get shoes that are not real heavy. The other thing to keep in consideration is the flexibility. If you wear hard shoes, you don't allow your foot to kind of bend the way it should, all those joints. You want your feet to actually bend when you walk, so that way you can adjust more. If you have flexible shoes, you're going to have that competitive advantage when you're walking or you're running. Now, a couple things to keep in mind in terms of foot strength, leg strength. Let's talk about Wolff's Law. Okay, so Wolff's Law is basically the more weight you put on your legs or any part of your body, the stronger the bone, the denser the bone. The less weight you put on it, the less dense it's going to become. So when I see patients that are wheelchair bound or lay in bed a lot, their bones are very frail. So what happens? when they fall, they break their bones right away. So to avoid that risk, what you want to do is you want to make sure that you're weight bearing, that you're standing up, you're walking, you're staying active. Just by simply standing, putting weight on those bones, you're going to increase that bone density. So just in case you have a fall like my neighbor did, unfortunately, you're going to be less likely to break your bones because you've been standing. So your bone density is going to be higher. The minute you start hanging out in bed, you start sitting a lot, your bone density is going to drop immediately. It's literally on an hour by hourly basis, and your bone density is going to drop and you're going to be at higher risk for breaking your bones. Now, in terms of the brands of shoes you should buy, I always get patients asking me, well, Doc, what are the best types of shoes? Well, I like New Balance, I like Nike, but that doesn't mean they're necessarily the best. What is the best is that meets those 3 criteria I mentioned, actually the 5. Having a low heel that's level to the toes, number 1. 2, you have a good arch support. 3, you don't have that toe spring in the front. You want your toes to be flat. 4, you want a wide toe box. 5, the shoes are... So let me give you the most important points to look at when you're buying shoes. It's not necessarily the brand. I do like Nikes and New Balance the best, but they have to meet the certain anatomical needs that we have. 1, the heel spring has to be low. The heel height has to be the same as the toes. That's number 1, so you don't damage your Achilles tendon. 2, you have to have good arch support, so it supports your arch. 3, you don't want the toe spring. You want your toes to sit flat, so you don't weaken your big toe. 4, you want a wide toe box, so your feet have room to spread. You have a wider base of support, better balance, less risk of falling. 5, you want flexible shoes so that your feet can flex when you're walking. You're gonna have more power in your feet. Okay, less risk of falling, more flexibility. Number 6, you want shoes that are not heavy, because if they're heavy, they're gonna lose your balance more, your legs are gonna get tired. So those are the most important things to look at when you're buying shoes rather than looking at the brand. So thank you for watching, and from Clear Lake, Iowa, this is Dr. Ernesto. Thank you and goodbye.